Let's get right into it. Number 9. The hospital straw. Take a look at a bendy straw for 2 seconds, and it feels like pure lunchbox nonsense. Birthday party junk. Something made to be fun for kids. But the real twist is that the bend is solving a body position problem. Joseph B. Friedman patented a flexible drinking tube with a 1948 priority date, and that little corrugated neck changed what a straw could do. Instead of forcing your face down to the cup, it lets the drink come up to you. It is basically a hinge added to a rigid tool, which sounds small, until you remember not everyone can just lean forward on command. That is why this thing mattered beyond the kids' table. Smithsonian notes the design made drinking easier not just for children, but for hospital patients who could not comfortably bend their heads to use a straight straw. And once that fix existed, it escaped into normal life. So now it shows up in restaurant cups, party drawers, and hospital trays, even though the smartest part of it was never the novelty. The fun part was functional all along. Number 8. The operating room gloves. You look at the gloves under your sink and think bleach, dishes, maybe hair dye, not surgery. But that is the twist. One of the most normal cleaning tools in your house comes out of operating room logic. Back in 1894, William Stewart Halstead is widely credited with introducing rubber surgical gloves in the U.S. at Johns Hopkins. And the reason they mattered was simple. Bare hands were a problem, they left skin exposed to irritants, and they left patients exposed to contamination. Rubber changed that by adding a barrier between skin and whatever you really did not want touching it. That is the part people miss. A glove is basically a peel-off second skin. It keeps blood, grime, chemicals, or microbes from making direct contact. Once surgery proved how useful that barrier was, the idea did not stay in the operating room. It spread. So the same basic logic ended up in kitchens, cleaning caddies, salons, and home care. The exact glove under your sink is not literally an old surgical glove with a new paint job, but the reason it exists in your house at all is the same. The house kept the glove after surgery, taught it why. Number 7. The surgical veil. Most people look at a face mask and think, that is a modern home object, something that showed up in your car, your junk drawer, or your travel bag a few years ago. But that timeline is way off. The medical logic behind it goes back to the late 1800s and early 1900s. The CDC notes that surgical masks have been used since the early 20th century to help keep wearer-generated bacteria away from surgical wounds. In other words, this was source control before that phrase became part of normal conversation. The basic mechanism is simple. It puts a barrier over the mouth and nose, catching droplets and splashes before they go where they should not. It is basically a splash guard for breathing. And the history is not just one inventor and one moment. Part of it runs through surgical wound protection. Another part runs through outbreak control, including work tied to droplet theory and figures like Wu Lien-te. That is why the mask feels weirdly modern and old at the same time. It came back into homes during outbreaks, but the idea itself had already been doing medical work for more than a century. Not a new social object, an old medical barrier that came home. Number 6. The battlefield tissue. Open a box of tissues, and it feels like the softest, safest object in your house. Colds, tears, maybe smudged makeup. World War I is probably not the first thing that comes to mind, but that is where the real story starts. During the war, cotton shortages pushed Kimberly-Clark to make a substitute material called cellucotton, and this was not just some random paper experiment. The material was used in surgical dressings for war wounds because it was light, absorbent, and disposable. In other words, the quality that makes a tissue useful now is the exact quality medicine needed then. It could soak up fluid fast, almost like a softer throwaway sponge sheet. Then the war ended, and the material had a new problem. It needed a civilian life. That is where the crossover happened. Kimberly-Clark later turned that wartime surplus and absorbent know-how into Kleenex facial tissue in 1924. So, the harmless little box on your nightstand is not literally a former bandage, but the material logic behind it absolutely came out of wartime medical need. The tissue kept the absorbency. It just lost the battlefield. Number 5. The hospital gel. If a bottle of hand sanitizer lives by your front door, it feels like a very recent habit. Pandemic era, travel size, backpack clip, something that exploded out of nowhere and then never left. But the real story starts in healthcare, not in your junk drawer. Alcohol-based hand rubs mattered because hospitals needed speed. In a clinical setting, you do not always have time to stop, find a sink, and do the full soap and water routine every single time. Sanitizer solved that workflow problem. It is basically a no-water shortcut for getting your hands clean fast enough to matter. That is why the CDC's hand hygiene guidance puts alcohol-based hand rubs right at the center of healthcare practice. And this was not just theory. Gojo says it spent years working with hospitals and researchers to build evidence for these products in reducing hospital-associated infections, and it points to a Boston hospital outbreak in 2001, where Purell was used to help control transmission. Once that logic proved itself in medical settings, it spread everywhere else. So the bottle by your door is not just a consumer habit. Your front door bottle is hospital timing logic in a plastic shell. Number 4. The battlefield pad. Start with this. A pad feels like a completely private, modern bathroom product. Clean packaging, consumer branding, drugstore shelf. Nothing about it screams war hospital, but the material story behind it is way stranger than that. During World War I, Kimberly-Clark developed cellucotton as a substitute for surgical cotton for treating war wounds. The reason it mattered was simple. Medicine needed something light, highly absorbent, and disposable. And cellucotton delivered exactly that. It could pull in fluid fast, almost like a cleaner, lighter sponge sheet built for one job and then thrown away. That alone would already be weird enough. But then nurses in World War I hospitals reportedly recognized that the same material had another use. A war product suddenly had a civilian future. Kimberly-Clark followed that trail, and by 1920, that absorbent logic had been turned into Kotex, the first mass-marketed sanitary napkin brand. So no, the finished consumer pad was not literally first sold as battlefield medicine. That is not the claim. The real twist is that the absorbent tech behind it came out of wartime wound care first and only later became a normal bathroom staple. The bathroom inherited a war hospital material. Number 3. The healing jelly. You look at a jar of Vaseline and think, lip balm, dry elbows, maybe that one person who still uses it on everything. It feels cosmetic now. Almost boring, but that is exactly what makes the backstory so sneaky. This stuff built its reputation as a healing product long before it felt like beauty shelf wallpaper. Robert Chesebro patented purified petroleum jelly in 1865, and the Vaseline brand followed in 1870. Early on, the appeal was not glamour. It was protection. People used it on cuts, burns, and irritated skin because petroleum jelly forms a seal over the surface. It is basically like putting a clear coat over damaged skin. That barrier helps lock in moisture and reduce exposure, which is why it worked as a practical household fix in the first place. And the medical texture did not disappear just because the branding softened. Vaseline's own history ties it to wartime use, noting that soldiers carried it by 1916, and later references a World War II sterile antiseptic burn dressing commission. So the little jar sitting in a makeup bag or medicine cabinet did not start as a beauty icon. It started as protective care logic that got domesticated. The beauty jar kept the first aid brain. Number 2. The surgical mouthwash. Listerine might be the most aggressively ordinary bottle in your bathroom. Minty, clinical looking, built to make your mouth feel like it just got pressure washed. So most people assume it was invented for bad breath. It was not. Listerine was first formulated in 1879, and Smithsonian's record is very clear about what it originally was: a surgical antiseptic, not a breath freshener, not some early self-care trend. A surgical antiseptic. That means the product started as a germ-fighting medical liquid, and only later drifted into the role people know now, which is already a weird enough turn on its own. Then came the category shift. The same antiseptic logic that made it useful in a medical setting could be repackaged for oral use, and eventually for the whole clean mouth, fresh breath world that took over the brand. In other words, Listerine did not begin as a bathroom lifestyle product. It became one. A disinfectant basically learned how to speak fluent consumer branding, and that is why this one hits so hard. The bottle on your sink feels like it was born there. It was not. It wandered into the bathroom from surgery. Fresh breath was the sequel, not the invention. Number 1. The rescue pen. This is the one item on the list that does not even try to hide what it is. An EpiPen sitting in a kitchen drawer or school bag still looks like emergency medicine, because it is. But the deeper twist is that even the way it works comes out of older self-injection logic built for speed, stress, and very little room for error. That matters, because normal injections assume time, precision, and a steady hand. An auto-injector is the opposite. It is a spring-loaded device carrying a pre-measured dose, built so a panicked non-expert can still get the medicine in fast. Think of it like a fire extinguisher version of an injection. You do not need elegance. You need something that works right now. Smithsonian says engineer Sheldon Kaplan developed the auto-injector at Survival Technology and was on the 1977 patent. Lemelson notes the inventors received that patent in 1977, and the FDA approved EpiPen in 1987. And the broader lineage matters here too. Science history describes the EpiPen as a Cold War spin-off, which is why this device feels different from everything else on the list. It did not just borrow emergency logic, it kept it. So while the exact branded EpiPen was developed for anaphylaxis, its form belongs to a bigger world of fast self-administration under pressure. The finale object is the one that still keeps its emergency badge.